So I grew up in a little town not very far from here, Wyandotte, Nebraska. And I think when I was growing up, it probably had about 220 people, so it's about 180 now, I think. I didn't go very far. I went to Mount Marty College and got my degree, and then went to medical school at USD. And then I ventured a little bit further down the road and went to Omaha and did my internal medicine residency and then my fellowship in hematology oncology. And then, I was married at the time. We wanted to come back and, live somewhere smaller, not in Omaha, and then we came and settled here and moved here 17 years ago. When I was young, I was thinking about what age I was. I was about 12, and my dad had cancer. He had a kind of an unusual head and neck cancer, and I think at that point I really thought it was interesting. Medicine was really interesting. And as I went through college and medical school, I was really drawn to oncology just because it was a great field, lots of new things coming out. And I just, once I started my internal medicine residency, I really felt like oncology was really a good fit for the kind of people that I wanted to take care of and the practice that I wanted to have in the future. I just really enjoy taking care of the patient. And, when I see patients, they usually have a cancer diagnosis, so really working to see what their side effects are, what kinds of treatment we can do for them, and really just trying to improve patients' quality of life and sometimes their overall survival, and really just enjoy, part of medicine is, it's a mystery, and sometimes we really have to work through that to figure out what's going to be right, and sometimes we have really challenging cases, and it takes a lot of extra people, so I enjoy working with the people on my team to figure out what's going to be best for patients. I like to interact with my patients on a small scale. We are, sit in an exam room and really kind of get to know each other. They're learning about me, I'm learning about them. I spend a lot of time educating the patients about what's going on with their cancer diagnosis. We do a lot of education as far as what their treatment options are. I also want to know what my patients enjoy, what their hobbies are, because that plays a big role into what treatment options we may discuss. So I think it's important for me to learn more about the patient than just what their cancer diagnosis is, but really learn to know what they are as a person. I have 4 kids, and I have a husband and a dog, and we spend a lot of time going to different kids' activities. So right now, I enjoy going to their activities. I also play the piano. I have a minor in music that people probably don't know that I have, so I enjoy playing the piano. I like my kids to be involved in some music as well. I like to read, but I just don't find as much time to read. Maybe in the future.